Hey everyone, welcome back to the channel. So today what we're going to talk about is we're going to go through 7 things that you need to do if you've just hurt your back in order to help you conquer your pain and get back some normal function as quickly as possible. These are conversations, or these tips are based on conversations that we have with patients every day in clinic. And I think regardless of whatever your back pain, whatever your diagnosis turns out to be, these 7 tips are things that you can do regardless of what that is. So they're basically tips to try and get you to a point where you can then have something done about it. You can go see someone. But as I said, more importantly, you don't necessarily have to know what it is that you've done here. So if you're watching this and you've just hurt your back, we're not necessarily here to try and diagnose what that is, but we're going to hopefully help you get through that initial tricky stage so that it can be better diagnosed, you can get around and do more. So I think the first tip that we want to start with, so if you've just hurt your back, whether it's you've woke up with pain, whether you moved suddenly and it hurts, or it's come out of nowhere, it doesn't matter how you've hurt your back, but if you're at that point where your back hurts and you're in trouble, the first thing that I want you to do is to find a comfortable position. So if you can lie down, if lying down is comfortable for you, whether that's lying on your stomach or lying on your back, it'll be very useful down the track for some of these other steps that you can find a position that feels comfortable for you in the interim. And we'll get to one of these tips in a minute, but eventually we want to get you moving around doing more. But to begin with, we want to find you a very comfortable spot, whether it's lying down. It may not necessarily be sitting down. It may not be standing. It might be lying on your back, lying on your side, or lying on your front. So that's tip number 1, find a comfortable position. And I should say too, looking back on these tips, you might find that a few of them are common sense or are not necessarily fancy things to do, but they form the basis of getting your body to settle down quickly. So it's good just to frame them in a nice, simple package to say, if you do each of these steps, you'll go a long way to making your symptoms feel better quickly. So tip number 1, find a comfortable position. Tip number 2, now this is potentially the most important tip out of everything, because it can determine how well and how quickly you can get through this painful experience. So the second tip is we need to get you to start practicing some deep breathing. Now, again, that may sound strange, but one of the things that we know about the body and your physiology is that pain isn't just based on tissue damage or tissue injury. It's not as tissue specific as we often feel it is. It has more to do with your brain and your nervous system's perception of threat. And obviously, whether you've bulged a disc, whether you've injured a ligament, whether a nerve's compressed or a joint's irritated or a muscle spasmed or whatever it is, your body is perceiving that as a threat. And yes, there may be some damage that falls within that, but there's plenty of people that don't have tissue damage that are sort of shunted into this painful experience, and it can be quite nasty and quite persistent, despite there not being some structural damage or some things that will show up on a scan. So what's really important for you to understand about your pain is that yes, it's spiked up and it's quite tender and sensitive at the moment, but we need to cue your nervous system into down regulating, lowering that threat perception and allowing that pain response to settle. So what we often find is that not only can your pain be based on the tissue, the irritation or the damage, but it's also based on your brain and nervous system's perception of threat, potentially even before you hurt yourself. So if you're someone who feels constantly stressed or anxious, or you've been going through some difficult times recently where it's been quite stressful for you, whether you've had some nasty things happen in your past, it sort of works together to conspire against us to build this profile of threat in the background. And then when we put our body in a position where the tissue struggles and reaches that threshold for dysfunction, if you're already stressed and your nervous system's already in a heightened state compared to where it can be sort of like a pain tax that's thrown on top of whatever is going on with your back at the moment. So it's really important to be clear and say that getting your pain to settle has a lot to do with making your nervous system and brain feel safer. So as we said before, lying down on your back, front or side, whatever's most comfortable for you, is a great starting position to take away a lot of the threat and the challenges that movement brings, and the stress and the anxiety or the frustration or the fear of the unknown of what's going on with your back right now or what's sort of happening to it. We want to calm everything down. We can use deep breathing techniques to utilize that capacity to down regulate. And what we find clinically is the faster you can down regulate your nervous system from a position of feeling threatened and painful to a position where it's a lot less heightened, then that pain experience can go down with it. So the type of breathing that I recommend is something called box breathing. It's very, very simple. We've made a video on this before, but the idea is that you take a breath in for say 4 seconds, just a 4-second breath in, you pause at the top for 4 seconds, you breathe out for 4 seconds, and then you pause at the bottom for 4 seconds before repeating that cycle over and over and over again. And the benefit of that is that your body associates certain breathing patterns with certain physiological states. And when we're stressed, and the classic example is someone who's just gone for a long run, and they're breathing in a shallow sense, and it's a lot faster, it's up in their chest, compared to someone who's nice and relaxed, where it's nice, slow, controlled breathing. Our bodies associate that breathing pattern with certain states, as I said before. So it's really important that we tell your body that we want it to be consistently calm and routine. And if you feel like 4 seconds is too easy, then stretch it out to 5 seconds, 6 seconds, 10 seconds, depending on what you feel comfortable doing, until you feel your body shift down a few gears. Now, depending on the severity and the amount of pain that you have at the moment, it could take you, 5 to 10 minutes to get that nervous system to physically feel like it drops down a bit. It could take you half an hour, it could take you an hour. But the key point about this breathing technique is that you need to keep doing it as much as you can, as often as you can, to get yourself down to a position where your body feels less threatened. You might have to keep doing it depending on what you have to get done during the day, but we need to take your body from feeling heightened and stressed and threatened and really painful down to a more comfortable baseline. And you'll find that that pain perception and that pain experience and the pain that's relating to your back injury or issue will start to subside the faster you can get that to downregulate. Now, obviously, if there's some genuine damage in your back or there's some irritation, there might be some physiological processes your body needs to go through to quickly sort of come out the other side of that. And that may take, a day, it might take 2 days, it might take weeks, depending on the injury. But the pain that you're getting from that can be controlled a lot better with some deep breathing exercises. So it's a really important step that you need to take control of that pain and get your body to a position, your physiology to a position where it doesn't necessarily have to generate as much pain because it's not as threatened as it was right when you hurt yourself. So that's tip number 2, really, really important. Tip number 3 piggybacks off of the back of the pain conversation in terms of pain medication. This is a very tricky subject to talk about. The general rule is you don't want to rely on pain medication. Obviously, there's a lot of side effects of pain medication that are well documented, but at the same time, you don't have to be a hero. So in terms of pain medication, it really depends on your personal preference and how this fits into your pain experience right now. So if you have severe amounts of pain, even from doing a lot of deep breathing exercises, and it's making you feel nauseous, or you just can't move, or you need to do something and that pain's getting in the way, or it's stopping you from sleeping, then it's understandable that taking pain medication is a valuable step in that process. Like I said, you don't have to be a hero. You need to do what you have to do to survive. But if you can get by without taking that pain medication, it's going to allow you to navigate through this a lot faster than if you are taking pain medication, which might sound counterintuitive, but we have to remember that pain is there for a reason. It's a protective mechanism from your body to tell you what you can and can't do. So if you're taking a lot of anti-inflammatories or pain medications in general, we're taking out a lot of the signaling that your body needs you to know to help you navigate through that minefield. So if you take some pain relief and get up and start doing something, but that something is beyond your body's current scope, then potentially you can be making things worse or dragging on that process just for the sake of some short-term pain relief. But as I said, if you feel like you absolutely need to take it to get by, that's completely fine. You just have to balance out the side effects versus the benefits. But as a general rule, if you can get through this, at least these initial stages without needing that pain medication, then your body will be better for it in the long run. So again, it's a really important step. It's not as clear-cut as saying pain medication or no pain medication. You have to find that happy balance that works for you at the moment. But I just want to make sure that we don't default to just taking pain medication for conditions or issues that may not necessarily warrant that at the end of the day. So number 3. So number 4 is a really interesting conversation that we tend to have around ice versus heat. Now, It's an interesting topic because I would always ask someone to lean more towards heat. But again, they have their pros and cons. So if you use a heat pack, I wouldn't necessarily get you to put it on the area that hurts, which sounds strange, unless of course you feel like it helps. So obviously we want you to default to what you feel works best, regardless of any outside perspective or outside information. If you put a heat pack on your back and it feels better, do it. But if you put a heat pack on an area that's become injured, then heat does promote more blood flow, which then in turn promotes more inflammation, or the potential for more inflammation. So while it may help with your pain, it may help you feel a bit nicer in the moment, if it's producing more blood flow and more inflammation in the area and you're not matching that up with an adequate amount of movement of the area to flush that inflammation and swelling out, then potentially you're going to be compounding the effects and making things worse. So you might find it's harder to get up off the bed. You might find that night times feel a lot worse. Ultimately, you might be delaying that healing process because you're sort of increasing the amount of inflammation there without having a balanced approach where you're taking away or giving the body a chance to flush that out afterwards once it doesn't need it anymore. So I think from a heat perspective, what I would always say to people, and this sort of is going to tie into what we'll talk about with the next tip, but you can put heat on areas that are stiff. So if you have an area of your back that's really painful, but you know that above that's really stiff, or maybe your hips are really tight, then you can place heat on those areas to feed more slack into your painful area. And that can help take away the threat perception. It can also help change the way you're loading that area, take some tension out of it, take the load out of it, so that your body can move better without being right up against that injured area or that irritated area consistently. So again, heat can be useful for pain. It's more useful for stiffness and tightness, which I would recommend, but ultimately it's based on how you feel. And then when we contrast that with an ice pack, we won't go into too much detail here, but we know that ice delays healing. It does everything that the body doesn't want to happen during the healing process. So again, it's a personal preference here because we know that ice can be good at knocking out that pain signal. So again, if you aren't necessarily keen to pop some pills, but you still want to feel like you need something to rely on to quickly relieve your pain, an ice pack may be something that helps you. But we need to remember to balance that out with the side effects where it's going to take away some of that pain signaling. So you're not necessarily going to be able to navigate through that minefield as good as you could if the pain was there. But again, it depends what you feel is important to you at the moment. But more importantly, if there is some healing that needs to take place, the more you ice that, the more you'll be delaying that healing process. Because ice restricts blood flow, which carries all the nutrients and all the inflammatory factors, and it can also prevent and slow down your body's ability to remove that sort of stuff. So much like heat can promote that and exacerbate that, ice can restrict that. Where in actual fact, your body knows what it's trying to do. So there's a happy medium that your body will default to. So you need to make sure that if you're going to use ice or heat because they make you feel better, there may be side effects that have to come into consideration that ultimately may guide your decision and influence your decision. But again, getting you through this initial painful stage, you may not even care. You may just need to do what you need to do to survive, but just be aware of the long-term ramifications of the duration of your pain and dysfunction after that. So again, we've talked about good positioning, we've talked about deep breathing, we've talked about pain medication, heat versus ice. Now, the fifth point that I wanted to touch on, again, comes back to what we touched on briefly with the heat pack, is we want to try and feed as much slack into your painful area as possible. We don't necessarily have to put a lot of pressure or treat the area that hurts, specifically if it's inflamed and irritated. But what we can do, if you've chosen a position that involves you lying down on your back, you can get a tennis ball or lacrosse ball or a ball that you feel isn't brutal enough to annoy your back. And you can go hunting above and below and around the area that hurts for areas that are stiff and tight. And what we find clinically is if you can free up a lot of the stiff joints and tight muscles above and below that, then again, you can feed some slack into that, restore some normal function, down-regulate that threat perception, and ultimately restore as much normal motion to those areas as possible, taking the handbrakes off, allowing that injured or irritated area to settle down faster. So again, if you use the ball and you are gently pressing it into your back and you find the exact spot that hurts, that's your pain, it depends on how sore that is as to what you can, or as to whether you want to keep the ball there. So if you have a little bit of gentle pressure on that and it feels horrible, but but you're deep breathing and you're taking that box breathing approach to down regulate that threat perception, and you feel like it's comfortable and your symptoms start to respond to that, then that's entirely appropriate. However, if it's too sore, then make sure you're just working above and below that instead, still using your deep breathing to try and control that pain as best as possible. And how it looks basically, very, very simple, is we want to place the ball sort of in the middle of the spine, but just off to one side. And remember, if you have some pain that's sort of down low, we want to hunt above that for things that are stiff and tight, because it could be referring or it could be indirectly creating some added consequences that you don't need. So with the ball, I'm going to place the ball into your back in the middle, just in a random spot, let it roll off to one side, and then we want to lie down on top of this and let the ball press in. So again, make sure that this is entirely comfortable for you. We don't want to feed into that threat perception. Use a ball that's soft enough that you feel very comfortable with. And all it is basically is finding a spot that feels restricted and stiff and letting the ball press in and just staying there. And again, it's a great time to practice your breathing. So and as you repeat that cycle, this will start to feel a bit easier as well. So as we said previously, we want to make sure that what you're looking for here are areas of stiffness and tightness, more so than pain and tenderness. So interestingly, if you find a spot on this side that feels really stiff and tight, but all of your pain's on the other side, if you come across to the other side and it doesn't feel stiff or tight, then guess what? You don't have to press there. You want to come back to the side that feels stiffer and tighter. Because as we say a lot on the channel, if one side of your body is stiff, even though we call it a left and right, it's still going to influence the other area mechanically because it's connected. Your body isn't two separate left and rights existing separately in space. They're genuinely connected by everything. So if there's some dysfunction in one area, it can create some dysfunction anywhere that associates with it, which can be the other side. So again, knowing where your stiffness and tightness is and just letting your ball gently press into that for a minute or two, 3 or 4 minutes, whatever works for you, then moving it down to the next spot or up to the next spot and working around systematically trying to feed some slack into your back can be a great way to kickstart that recovery process. Now, the other side of this exercise is we want to get the ball into your hip muscles. So you can put the ball into your glutes and lie down in the same position that you're in. Go looking for areas below your back that are tight and stiff to feed slack up from underneath. So again, we want to try and take as many handbrakes or as much tension out of that area as possible so it can settle down as quickly as possible. So that's tip number 5. Now, tip number 6 is not necessarily for everyone, but ultimately it should be, and that's movement. So again, if you are in a lot of pain, movement may not be your friend, but the reason why we want to promote the use or the lack of use of pain medication and ice and those sorts of things as much as possible, because we want to know what you can and can't do. Because if you can get up and just gently move around and walk around, then you absolutely need to, just to keep your body functioning normally. If it's too much for you, that's absolutely fine. At some point, you'll reach that point, or you'll reach that scenario where movement is entirely appropriate for you. You might need to spend a lot of time down regulating that nervous system so your body feels less threatened to allow you to start to express sort of movement again. But the body is wired for movements, and a lot of the physiological processes that involve sort of healing and sort of recovery are based around movements. So we need to make sure that where possible, you're just drip feeding some movement in there, even if it's just changing positions or getting out of the bed to go to the toilet and coming back down again. You need to make sure you're at the comfortable limits of what your body can tolerate and not just relaxing consistently for 2 or 3 days until you feel like something changes. If you want to get through it faster, you want to definitely have those periods of relaxation and immobility to allow those processes, some processes to get better, allow the sort of tension to come out of it to make it feel a bit nicer. But you've got to sort of intersperse that with periods of movement so that the body can start to function more normally. You can sort of flush out a lot of the waste, you can get the muscles working, the tissues to move again, get your body feeling more normal. So it may not necessarily be the first step, which is why we've left it to sort of tip number 6, but movement is really important at some point. So make sure that if you are aware of your pain in its entirety, so it's not sort of masked at all, you'll know how much movement is too much. You may even know how much movement is too little, depending on how stiff and tight you feel. But you want to be in that sort of window, that small window, however big or small it may be, as often as possible. So that's tip number 6. So the last tip is a really obvious one. It's once you've had a go at trying to decrease your pain, get your body moving a bit more, return some normal function, which can happen within the first half hour to an hour, 24 hours, whatever it takes for you and your specific issue at the moment. The final step is to go and see someone. So obviously seeing a physical therapist is really important for them to help you diagnose what your problem is, but also for them to give you specific guidance on what you need to do. Because if you have a disc bulge or a nerve root irritation, or whether it's something really simple relatively like an irritated joint or a muscle that's spasmed, there's some specific things that they can do to you to help those areas feel better, but there's also some exercises and some things that you can do to help you navigate through that, which will be different to someone else. And obviously we want to make it as specific as possible so that you can get through this as quickly as possible. And that may require you to see your doctor first to get a referral. Not all physical therapists need a referral. Not all insurances require a referral for you to have physical therapy, but it's really important that when you are able to, you go and see them so they can give you some specific things to get you through the pain, but then also once your pain goes away, to give you some specific advice as to how to stop it from coming back again, what caused it in the first place, where you might be lacking in terms of strength and flexibility, how your posture is, whether it's good or bad. Spoiler, if you've got back pain, there's every chance that there's some postural improvements you can make. But ultimately, you need someone to sort of work with you as a team to solve your problems. And I think that's a really important tip to sort of finish up on, because there's all these things that you can do to really help sort of conquer the origins of your pain, where you don't just have to wait for things to get better. You can actively try and make it feel better through the deep breathing, heat or ice, depending on what works for you, movement, lack of movement, all of those things that is specific to how you're going at the moment. But being able to understand the concepts that we've just presented can really help kickstart your recovery, so you just don't feel like you're having to wait for 3 or 4 days for that pain to start to drop down once your nervous system eventually starts to feel less threatened. So you can take charge of that. And I know if you're in pain at the moment, it sucks. It's probably quite scary. The unknown is quite challenging. Again, all these things, the uncertainties that come with backs, is your back ever going to be better again? Is this, a thing from now on? You're just someone who has back pain. All of those things can feed into that sort of heightened nervous system, which can in turn, again, create that pain and keep that pain there. So it's all the more reason to go through these steps to make sure that you feel like you can start to pull that down a little bit, regain control, and hopefully take away a lot of the mystery about what's going on. So hopefully that was really helpful. If it was, let me know in the comments below. Let me know how you're going. Let me know what you're dealing with. If you have any specific issues, please tell me. If you found these 7 tips useful, please leave a like below just to let me know. And if you are new to the channel, please consider subscribing just so that you get more content like this, but it also helps these videos reach more people. So the sole purpose of this is to help people when they may not feel like there is help. Hopefully I've got a little bit of a different perspective on things than a lot of people. So hopefully I can give you that aha moment, or that last piece of the puzzle that you didn't know that you were looking for. It can really help you regain control and get back to what you want to do. So hopefully that was useful. Best of luck with your pain. I am here if you have any questions, but until the next time, I'll see you soon.